And welcome back to Canine Chat Episode 2. I'm your host, Paul the Dog Trainer. Today on the line, we're going to be talking about anxiety and socialisation. I have with me on the line Dr. Robert Holmes. Now, Robert is a veterinary behaviourist located in Melbourne. He is a qualified vet and has a PhD in animal behaviour, working with mainly 80% dogs and 20% cats. His qualifications go on, and there's no one better to speak to, in my opinion, about this subject. What Robert does not know about animal behaviour, in my opinion, isn't worth knowing. If you want to see more about Robert, then head over to www.animalbehaviour.com. Now, without further ado, I welcome Dr. Robert Holmes on the line.
Oh, thanks, Paul, and thanks for inviting me on.
No, you're welcome. It's great to have you, especially someone with your stature helping out with a topic today about anxiety.
Yeah, look, it's such a biggie. I'm delighted to have any opportunity to get out there, the way I understand it anyway, because many people see it in a different way, the same sort of behavior. But this is a really useful line to look at, lots of dog behavior.
Yeah, definitely. And I know that with the dogs that I work with and the other dog trainers that I know, and we all seem to treat anxiety a little bit different, from vet to vet, from veterinary behaviourists and so on. Everyone treats it a little bit differently, and I really appreciate your input today. I put it out there to my listeners on what they thought was some questions they might want answered about anxiety, and I'll run through a few to see what your opinion is on them. One of the people asked me, is anxiety medication important, and why?
Well, it's one of the options for treating anxiety. And there are times when we're not getting any traction on the problem because the dog is so anxious that it can't learn. And in that case, medication can help. In fact, the most widely used medication, which is commonly known as Prozac, I regard as a training aid, not as a magic bullet, but just something to speed up the rate of learning.
Okay, that's a great answer. There was two other questions that went along with that, which is why do vets prescribe medication and some don't, and isn't a behavioural modification plan enough? And I would have to say that potentially behavioural modification can work, but if you're not getting any traction, then medication may be able to aid in the process.
Well, yes, and we also need to consider the severity of anxiety. I mean, the anxiety, in fact, is quite normal and natural, and without it, we're dead.
Yeah, it's true.
But it's a very self-protective mechanism. But it can get out of hand, and it can become a disorder. And with a severe disorder, often we don't get any traction without medication. And sometimes, of course, there's an urgent need to get on with the job, say the safety of people, and so we throw the book at the problem. And that is one of the 6 steps that are available in dealing with anxiety.
Most of my followers and likers on Facebook and my clients don't really know how to notice, or they don't know what anxiety is. They think it will be something else. They won't realize. And what would you say the early signs of anxiety that should be addressed or looked at a little bit more closely and not ignored?
Yep. Well, you can divide the responses to anxiety as physiological, and we can often see that in panting or shivering. But sometimes the heart rate is up, okay, and sometimes dogs will poop, and sometimes they will salivate. Now, there are lots of different reasons why dogs could do those physiological changes, as we can find with the behavior changes. And they can be roughly divided into 3, and we're very used to this: fight, flight, or freeze. And, of course, fight, aggression; flight, avoidance, running away, escaping; and freezing, just immobility, and the dog's just not moving. And we suspect there are some dogs that are basically just frozen, and they're not giving those fight and flight responses. They look outwardly immobile, but they can in fact be throbbing away inside their brains, being really quite distressed.
So for the common pet owner in the home, signs of anxiety such as panting and those sort of things are actually quite normal in some circumstances. Maybe the dog's had a run, or they're a little bit tired, or they're very hot.
Yeah,
is there a way to differentiate between panting when they're hot and panting when they're just a bit anxious or nervous about a situation?
Well, what we need to do is to look at context. And behavior, in fact, can only be interpreted in context, as can physiology. So you have to say, well, what other possible reasons is this dog panting for? And you've just given a very nice, succinct list there, Paul. you can't say, well, it's not hot, it's not just come back from exercise, it's short of oxygen, you then say, well, in the context, is there something that the dog could be worried about? In other words, is there some unpredictability? And this is the key to understanding anxiety. It's the emotional state produced when there's unpredictability, or the dog perceives as unpredictability, like an unfamiliar dog, unfamiliar person. They're unfamiliar, so they're unpredictable. And then the second leg of the double is, does the dog perceive that it's got some control ability? Could it show fight, flight, or even freeze? So we actually diagnose anxiety by excluding other possible reasons and looking at the context.
Okay, so it's basically just working out what it's not and being left with what it could be and working from there.
Yeah.
Okay.
Exactly so, because we're dealing with an emotional state that has certain expressions, and the physiological expression or response and a behavioral response. Now, there's no behavior or physiology which is exclusive to anxiety.
Yeah.
It's a package which we need to do an interpretation of.
One of my listeners asked, how much is the dog and how much is them? So I do know that working with dogs a lot, that they do mirror the energy around them a lot of the time.
And that's a really important aspect.
But how much is the person that owns the dog, and how much is the dog just not dealing with situations?
Well, I can't give them a value like 60%, 40%, because I don't know how long the piece of string is. All I can say is that it's good to think of behavior as having three general causes. There's a genetic component. Does the dog have a genetic tendency to be anxious or not? There's a learned component. Has the dog become classically conditioned to associate anxiety with particular circumstances? And then there's the third element, and that is what's happening in the here and now, the environment. That's the present environment. And the owner, handler, carer, whatever you want to call them, is a vital component of that. Because we know that dogs are really cluey at picking up human body language. And if they see that the owner's uptight about something, they say, hey, there's something around here should be worried about. I better get anxious and get my body like a good Girl Guide and a Boy Scout to be prepared to deal with a circumstance. In other words, to control it when that unpredictability might just develop into a nasty. So I'm going to be ready for it. So they can pick up on their owners, and people who are close to dogs know that the dogs know your emotions. Even when people are trying to bottle it, they'll come up and lick their faces.
That's really important note. So basically, anxiety, in your words, is basically a way for dogs to deal with situations. But sometimes they can get out of hand.
Yeah, that's right. That's what it's all about. Anxiety is a very important attribute, the emotional state, to deal with unpredictable circumstances, to get you ready. Your body's tuning up. That's why you're starting to breathe more quickly. Your heart rate goes up. Okay, so it's the classical thing which good old Baden-Powell started for the Boy Scouts. Be prepared.
I've got quite a lot of people on my page and people that I talk with through rescue groups that raise a lot of dogs that are earlier than or younger than 8 weeks of age, that they may be found when they're 1 week or 2 weeks or they've been dropped off. Have you got any tips on, maybe how to alleviate some anxiety occurring later on? I do know that professional breeders and things like that have really good practices for raising dogs, but the average person might not know what to do. Have you got any tips that may help them?
Yeah, well, the desirable thing to do, of course, is to have the dog on the bitch, because there is no person can possibly carry out the attention that a bitch will carry out in those first few hours, days, and less so over the next weeks. So there's a real problem in orphan rearing puppies, and it's a very controversial area, and it's a really heart-rendering tough area, which we can perhaps go into some other time, Paul. The ideal that I see it for a puppy that's destined to be a dog living with a family, particularly in a metropolitan area, is that it be whelped in the kitchen of the person who is in charge of it, the breeder possibly. And the idea is that from the age of between 3 to 5 weeks, when they've just got their ears and eyes and everything functioning, and they're exploring, they can perceive the world around them. And the kitchen's a very busy, noisy place. And they, at that age, they can't develop fears because they're so immature. The brain has not got any capacity to show avoidance or fear responses. So they, in fact, only start to show that at 6 weeks. So in 3 weeks, you can expose them to a wide range of stimuli, you know, the banging and the clanging, the smells, the being lifted up by kids and things like that, hopefully gently. And they can only have a good or a neutral association with it, not a bad association. So in later in life, they say, oh, yeah, I've seen that. I'm familiar with that. That's no sweat, no trouble. And so it doesn't cause that anxiety response.
That's one thing that I talk about all the time is people often get dogs at 8 weeks of age and they get their first vaccination and they get the second vaccination, and they often don't take their dogs out until 12 or 13 weeks of age to puppy school or to anywhere because they're afraid of getting certain diseases and things like that. And it's a little bit off topic, but I would like to know your opinion on when do you think it's the best time to socialise your dog, at what age, and how do you need to be smart about it?
Yeah. Well, there are two things. Recognizing the sensitive period of socialization, which starts at 3 weeks and finishes at about 3 months. But it's like Easter. It's a bit of a variable feast. Varies with individual dogs. And that's the optimum time to socialize them to the species that they're going to see in later life. So there's people, of course, and we need to subdivide people into adults and that subhuman species called children, particularly toddlers, because dogs react differently to them, just because of their behavior and size, presumably. And any other species that the dogs likely to need to get on with: cats, horses, goats, whatever. And now that's one aspect, the socialization. But the other aspect is the need for being immune and be resistant to the diseases. Now that varies geographically. You really need to take the advice of vets in your area as to how hot or otherwise the disease status is in the area. Now, having said all that lot, for most areas in Australia, then it's quite safe, in fact, to have a reasonable amount of socialization under control. That's, you go to places where the dogs are known vaccine status, and you would avoid areas where there could be any old dog wandering around. You can't really test. You don't really know what's happening. So the important principle is that, in fact, it's probably more dogs end up dead through lack of socialization than through lack of immunization. That's a big, broad generality, but you have to look at it on the geographical basis of where your pup's being brought up and seek veterinary advice.
That's a really big statement, and I would have to agree with that 100%. Now, thank you very much for joining us today, Robert, but I have one last question for you. What would your quick tips to avoid or help anxiety would be for the average pet owner?
Well, if you can, you go right back to conception, and that is to make sure that if you can, that the sire and the dam are preferably bomb-proof dogs that don't have a propensity to be anxious. So you start off with the genetics, and then you look at the experience and look at the environment in which the pup has been reared, and then you do as much as you can to, depending upon the dog's personality, to expose it appropriately, handle it appropriately, and if it has got serious issues, get onto it early, because the earlier we can do that, the less likely there are to be consequences in older age, things like middle-aged onset phobias, and, dare I say it, the dog should live that long, of course, dementia.
Well, thank you very much for joining us today, Robert. I really appreciate your insight, and I know that my listeners will really appreciate it too. Thank you for spending some time out of your busy schedule to join us today.
My pleasure, Paul.
Well, there we have it. Another episode of Canine Chat. Thanks for joining. A subject like anxiety, you could talk for days and still only touch the tip of the iceberg. I hope you did learn a lot and learned about possible causes and ways that you can help your dog live a better and healthier life. Stay tuned for next week where we talk about nutrition, dry food versus raw food, what is best for your dog, and more.